afternoon, everyone. This is a challenging spot for anyone to be at right after lunch. So hopefully we can keep things exciting and interesting for you. So I'm here along with my colleague to talk about our MSD Mission Impossible, which it feels like sometimes, but we're hoping to turn that into a Mission Possible. So my name is Becky Sherratt, and I'm the Occupational Health and Safety Officer for Sault Area Hospital, and I'm going to be presenting with my colleague Cindy DePiro, who is our ergonomics and wellness consultant. And in fact, to keep us up and entertained, we have someone who's going to zip in the middle of our presentation. I'll let her introduce herself when the time comes. Okay, let's see here. Oh, our graphics. I guess we should have started that. See, I told you we're going to keep it interesting. Okay, so for those of you who might not be familiar with Sault Ste. Marie, we are from Northern Ontario. We're about, you might have heard of Sudbury. We are 3 hours north of Sudbury. We have a population of around 75,000 people, and the best Italian food going. So just in case anyone's traveling up that way. Okay, so we serve at Sault Area Hospital, we serve a catchment population of around 120,000 people. So those people being from Sault Ste. Marie and the surrounding rural areas. We currently employ, I guess I can look here on my screen, sorry. We employ around 1,900 staff members, give or take, 130 physicians, and we have anywhere from 450 plus volunteers helping us out at the hospital. So we have a significant amount of people helping us deliver quality patient care to Algoma. So that equals around 2.3 million work hours a year. And if you'll notice by our picture up here, we have moved recently, and recently for us is 5 years ago, still recent, into a brand new state-of-the-art facility. And it has been a tremendous blessing for us. If any of you are familiar with our old site or our old accommodations, this is an extreme step up for us, and it really did go a long way to help mitigate some of the challenges and barriers which people have already discussed today, such as availability of equipment, design of rooms, and so on. So I'm going to paint you a bleak picture. We have gone through dark times as an organization, and it's something important to, okay, everyone's laughing at the animation, right? Okay. Okay. So we have what we would call a dark past. I'm going to take you back to 2005, and I promise I'll be really quick about it, but it's a significant time for us. So we had significant issues in terms of worker safety. Our safety performance was abysmal, including in that time a violation of the Occupational Health and Safety Act, which result in fines and charges to our organization. We were also struggling with patient safety. Staff morale was very poor. Our patients and families were dissatisfied with the care they were receiving. And for those financial people in the house, our deficit was a major issue and major concern. And all of this while we're trying to plan a new start at a new building. So it was a significant time in which we realized that we needed to make some changes. If we look at our patient handling record, our incidents at that time, they reflect what was going on in the organization. So to give you some numbers, our MSD incidents, or our patient handling incidents, we had 180 reported in that year, and 57 of those resulted in healthcare claims to WSIB, and 34 resulted in lost time from work. So that is a significant challenge, and something saying we needed to change is really an understatement. So we're going to try and tell you about some of the things that we did in those early days to improve our safety record, and then we're going to talk about where we've been in the last year or two and the changes we need to make. So number one, and it's been said before here, you need to start at the top. If you don't have leadership that is committed to making a change and sees the value in creating a workplace that's healthy and safe and well for our workers, we're not going to get very far in anything, and you're not going to be able to push those safety programs through. That commitment is key. And for us, this time was significant. So 2005, 2006 is when our current CEO took over command of the hospital and really tried to steer our ship in a different direction. So his commitment to staff safety and patient safety has been an enormous component, an enormous reason why we've been able to be successful at making changes. So one of the ways that he really demonstrates that commitment is by sitting on our Joint Health and Safety Committee as a management member. So as our friend will tell you in just a moment, it is a hats-off approach. So it doesn't matter that he's the CEO, but it sure brings a good perspective, and it's a sure great way to highlight issues and have things shoot right to the top to get things done and get issues noticed. So if I can give any advice, if there are any CEOs in the room or anyone who can influence your CEOs, get them on the committee, or at least get someone from senior leadership there, because it makes truly a huge difference. Next is working on collaboration with the union and building that trust relationship. So I'm going to hand over the mic briefly to our friend Pam Mancuso, who can speak a little bit about that.
So as she said, I'm Pam Mancuso, but I was the co-chair of their Joint Health and Safety Committee for 18 years. And when we had that abysmal time period, the dark ages we call it, I decided that we needed to come together. We needed to take our hats off. And our CEO is Ron. Ron, you're Ron. We're all workers, so let's look after ourselves. So we decided to come to the table and try to bring some trust back. So we started to build our relationship, and as well with the other unions, because it isn't just the Ontario nurses that were sitting there. We had other unions as well. It wasn't about our unions, it was about workers' health and safety. And so we came to the table with that, and I think from that point on, we started an upward trend, and they're going to tell you about the successes that happened after that. But having Ron, the CEO, sitting at the table made a huge difference, and it was something that we said, we don't have to go running around trying to get permission, because he's sitting here. And if he thinks it's something that's going to work and cause a positive change in our workplace, he'll do it. So I think that makes a big difference. So over to you now.
Thanks, Pam. One of the things that has been talked about a lot today is obviously any safe patient lift and transfer programs that are out there. We started ours, and then we used the acronym SPLAT. Some like it, some don't. I'm iffy and on the fence and may change that, but nonetheless, it is catchy and people remember it. So that is how we started with our program, SPLAT. And it's terrible that we're talking about people, but it works. So that's where we started with the program. What we included in there were the policies, procedures, and expectations of our people touching or handling the people. It is very well laid out in that manual. Unfortunately, in my opinion, the manual's gotten a little too big, and when we overdo things, people don't listen. We need to simplify things a little bit more, so we're going to work on that a little bit. We also introduced, obviously, equipment into the hospital, much like everybody else in this environment today. One of the things we have to talk about is availability. Some of us have already alluded to that today. One of the things that we are missing, I think, is it's simple that we have the equipment. We know that it's there, but if the people don't know where to go to get it. I've sat in on debriefings for lost time claims where people say, I didn't know where it was. That's a simple answer. They were being honest. Why did they not know where that was? That doesn't make sense. Our laundry services, I think somebody alluded to that today. They play an integral role in our equipment, where to find it, when it's available. So it's really important to know where it is, how to get it, and also the laundry services, and this is our history at the hospital, the laundry people giving us those services, they're not well educated in some of the stuff that we talk about every day, and we talk about it like it's something we say in every sentence. They don't understand that language. It's really important to set that standard if you're utilizing that service. We've had umpteen times where they would call down to laundry to ask for a certain sling. I would like the 5-point red harness sling. And they get up there and it's not the right one. Well, our laundry people are not educated in that. So we took the time to do that education with them. Our community resources are huge. I know we live in a small community. when we don't know something or we don't know the answer, we look for help with our local vendors. We had about a year and a half ago, a 750-pound man walk into our emerge department on a Saturday. By Monday, we had 5 or 6 safe patient handling incidents across my desk because he got up to critical care and nobody knew what to do. Where's the equipment? How do we handle them? We have to make sure we're using our resources in the community to help us with that. Government funding. Gosh, sometimes we get some of that, and sometimes we don't get it. Where will it go? Where will it be spent? We took the time to do that and made it very clear where our priorities were with that. Our new hospital, as Becky had told you already, was a very good new opportunity for us. There are plenty of opportunities in there. I will say from our experience at the hospital, we could have done better in the design portion of the new hospital. I still don't understand why we have hospital, and we don't have a good design for one hospital to use from one place to the other. So it was getting involved with certain services in our hospital that we could design their areas. As the ergonomist at the hospital, I was involved with some of it, but not all of it, and we missed the boat on some of that. So, and then there was reinvestment of near rebate. We did get 1 or 2 along the way. We got a substantial one a couple of years ago. We used our frontline staff to fill the gaps of where we needed to spend that money. They are the users of the things every day. They are the experts, and we sometimes forget that. You need to involve them and help us figure out where the gaps are. Do the assessments with them and have a really close conversation about that. Make sure they understand that. Moving on in our mission gear bag, of course what we're talking about today, a lot of it is the education. So at the hospital, of course, we have our manual material handling program, which is also covering our MSDs. The Splat Program, what does it entail? It's a 5-hour total program. Every new employee goes through 5 hours of training that comes into the hospital that is related to patient handling. It includes the theory, and most of it is included as the practical component. It's hands-on. The other piece that we've included that has made a big difference is our vendors for our equipment are coming in to show our people how to troubleshoot the equipment. I get lots of calls sometimes saying you come down, the overhead ceiling lift isn't working. Okay, but you pulled the kill strap. It's not supposed to work. So they don't understand how to troubleshoot it, and that's where we miss the boat sometimes. If people don't use the equipment because it's not working, this is a risk for injury and where we are losing some opportunities too. So having them involved is really, really key. We do department-specific training. So again, depending on what department you work in, you may have specific manual handling risks that may not be present in other departments. So we make sure that we're covering those gaps as well. The dissemination of high-level MSD video that we have completed at our hospital. About 2 years ago, we had a videographer come in and tape a 7-minute MSD video. And it's simple. The message to our people is simple. And they get it and they understand it. You have to talk so that they understand it and simplify it. That was really important for us. We do blitzes once or twice a year about MSDs, not specifically related to patients, but it is included as part of that blitz. There's daily department huddles. So every morning at 10 o'clock, you will find in our hospital, every single department is going through a huddle where they all come together and they meet at a board and they talk about the risks and the things that are happening. The MSDs is part of that, as part of the blitz. So our MSD change team, we received some government funding to include a participatory approach to reducing our MSD risks at the hospital. And we went through 2 departments. One was a medical department, focusing on the patient handling. The second was a non-medical unit, which was our housekeeping staff. I mean, everybody knows in this room, those who do the work change the work, and this was a key component to that program, and it was a really, really good success. The other thing we added to our risk assessments, instead of the monthly, we still do the monthly, but the MSD portion was not on that monthly assessment. We included it, we incorporated it, so that it is looked at every single month from our Joint Health and Safety Committee team. That was an important gap that we had missed prior. Our wellness promotion, I'm the ergonomic and wellness consultant at the hospital. I'm always promoting wellness. We have wellness moments that we have incorporated for our staff where we have a local vendor that will come in and do moments on the fly. So in the medical department, she will show them, how can I reduce stress? How can I do a quick body change? How can I do some stretching on the fly? Because a lot of times they don't have the time to step away from the work. So we want them to be making a change and doing it that way. That has been a really big success to us too. The other thing is with the wellness promotion, we're always trying to incorporate a very supportive environment that is holistic in another approach. So we're going to talk about that in a little bit as well. Much like you guys, we have challenges. Our enemy territory and our Mission Impossible includes the same as yours. Competing priorities, we all have them. Organizationally, patient needs, they all change. Funding, as far as the budget goes. So for us, a big one for us is the backfilling for re-education. Re-education seems fairly straightforward to me. I don't handle the funds at the hospital, and they're probably pretty glad I don't. But it's easy. You bring them in, you educate them. But the reality is you got to backfill the people you're pulling from. So that was one thing that we had to contend with. Staff compliance, or as Mike said earlier, the competence, perhaps, is another issue for us. The patient assessment piece, I have this with asterisks beside it, because it's not being done. It is not being done enough. It's not being done frequently. And it's a simple question to our staff who are touching the people: what has changed? You may have come in on your shift at 7 in the morning and you're very busy. You may not go back to that patient for 3 or 4 hours. Something may have changed between that 3 or 4 hours. What has changed? Because whatever has changed is going to affect how you do your work safely. And this is the piece our people are missing. They're taking shortcuts, or they're not doing it at all. And again, we had talked about this already, the patients falling to the floor. As healthcare workers, I think that's innate. We just grab them and go. It's difficult to let them fall so that there's minimal damage there. And then, of course, sticking with it. Sticking with it does take time. Sticking with the course of action you want to do is also something that we had some issues with the people that we chose to help make the changes and do the work. So those are some of our challenges, and I'm sure they're similar to yours. MSD incidents that we've seen since 2005 to present, we've had a 91% reduction in lost time incidents, which is pretty astounding for us from where we came from, as Becky had told you earlier. 38.5% reduction in healthcare incidents. It's okay, we can do better, and that's something we want to definitely work on. Specifically related to our patient lift and transfer incidents, 81% reduction in lost time incidents. That's a big number for us. And then our healthcare incidents, this is where we're struggling. Relatively no change, our mission continues. So this is something we need to work on. And let's make quick reference badges, so that our people who are handling the people can do those quick assessments that need to be done every single time they go in that room when they touch a patient, so that we can do that really quickly and easily. Mandatory re-education, for our clinical people every 2 years. That's something that we're going to be doing with our learning management system, so we can reduce the cost. Education of our allied health and support services, OTs, PTs, porters, DI. Currently, our DI and our porters are not done. We're going to include that. Mandatory training for all leaders. And we have talked about this on and on today. Our leaders have no idea what's going on with their people. They have to understand it and be the leader for those people and step up and understand it. We're going to do Splat Champion training, similar to what Arlene had talked about earlier with her mobility coaches. That's something we plan on doing and rolling out over the next 6 months with our pilot medical department. We're going to be using the people on the floor to be the people that roll out that champion training. Two things that aren't included here. Our Joint Health and Safety Committee will complete a participatory approach to high-risk areas. They're going to go out and ask the people, where are the issues, where are the problems? We need to know. The other thing we're going to be packaging as a holistic approach is Healthy, Safe, and Well at Work program. And we're going to be encompassing everything from the ergonomics perspective, the patient handling, to the wellness at our hospital, and packaging and putting it all together as one whole supportive program. And we plan on doing that over the next 6 months. And that is our mission, and we're going to accept it, absolutely. We're going to continue. Thank you.